And this morning we hosted a workshop for pharmacists, non-medical prescribers, to give them a forum to discuss the issues and the challenges that they face in their day-to-day work. I was looking after the getting started work stream, so people that are perhaps just undertaking their non-medical prescribing course or just setting out in their journey as a non-medical prescriber, and need some tips and help and suggestions from other people on how to set up their clinics or their prescribing roles outside of a clinic. The main key points and piece of advice that came out of it were to make sure you find your niche. You know, where is there a need for your services? Where would they be beneficial? As a pharmacist, what extra do you bring to the patient over and above what perhaps a doctor could do or what a nurse could do? And it's useful to have that in mind when you're pitching your clinic or your service that you want to provide. It's really important that the service is robust. So what will happen if you're off sick? Is there somebody that can backfill you? Is there somebody that can step into the gap? What will happen to the patients if you're not around? Where are you going to do your clinic? Is there a space for you to do it? Are you going to do your prescribing on the day unit out in the open? There are lots of different models, and as I was discussing with different pharmacists on the table, they had lots of different ideas about how they were going to set about setting up their prescribing practice. So one of the other important things was to engage with the multidisciplinary team to make sure your service fits in around what everybody else is doing and that you've got the support of those around you. We also talked about what resources could help them overcome the challenges of setting up a new service like that. We talked about reviewing evidence or perhaps having a repository for published papers on the subject of pharmacists prescribing clinics and the benefits that that brings. We also talked about networking events. One of the best things about the event this morning was just people having a chance to talk to each other and discuss. So if you're trying to set up a service and you've just met somebody who is actually already doing something like that, it's really valuable to get their insights. And even if there wasn't much time at the meeting to talk about it, you know, they know who each other are now and they can catch up over coffee later. So, you know, we've started off a lot of good conversations. So I think it'll be important for BOPA in the future to create networking opportunities and perhaps set up a non-medical prescribers forum on our website. Resources that people thought they might find useful would be sort of lists of journal articles that they could use, for people to share their clinic plans that they've already set in motion, for people to use as a template or a resource, and also potentially to come up with standard scopes of practice for people to use and compare with each other.